Greetings, this is a coronavirus COVID-19 update for 2/28/2020. Okay, we always start out with Baidu, which is a Chinese search engine, and Baidu set up a page to track the coronavirus inside of China. So we'll go over these numbers pretty quick. Confirmed diagnosis for today, 37,502. That's not a very important number anymore because it's included in the cumulative diagnosis. It's 79,389. Suspected cases 1,418. Cures 39,049. That's a little bit deceiving because China did not cure 39,000 people. Most of these people just recovered on their own. The mortality rate's 2% or less than 2%. Depending on what country you're looking at and what time frame you're looking at. But, most people who are confirmed to have coronavirus, COVID-19, just have flu symptoms for a couple days and then they recover on their own. Existing severe cases, 7,664, and that's people in ICU units, intensive care, either on a respirator because they have pneumonia, can't breathe very well, or hearts or other organs are severely affected. And deaths in China, 2,838, up 47. So that's historically 47 in the last couple days are similar, and that's low because before a few days ago they were averaging 100. As you scroll down this Baidu site, which I'll put in the description below, there's a map of China that doesn't change very much, but it's there. Then you see the first graph if you scroll down even further. And this changed a couple days ago. What they map on here, if you slide your cursor across the right-hand side of the screen and land it on any day, really, you can see the numbers for that day, the new numbers. So number of deaths went up 47, cures up 2892, and then the suspected cases and new diagnosed cases. So newly diagnosed is up 430, which is also down historically, but up from yesterday. As you can see, the red line's been going up and down every day just about. And that's kind of crazy, but that's what's been happening. But that's a downward trend. In the second graph, if you scroll down even further, you'll see non-Hubei province, which is the gold line, which is the rest of China outside of Hubei, which is where Wuhan is located. And then you see Hubei by itself in the pink line, which just about exactly follows the national line and these are the up numbers from yesterday. Up 7 for non-Hubei province and up 430 nationally and up 423 in Hubei. Hubei is still a hotbed of the coronavirus. Then if you scroll down further, you'll see a list of provinces, and you can open up these provinces and take a look at cities. It actually defaults to Hubei being open with all the cities under in the province. But if you close that little arrow, down pointing arrow there, you can see all the provinces. And Guangdong is, there's two big numbers here. Actually, not Guangdong. Guangdong is the most populated province in China. And, it has a couple super cities, Guangzhou and Shenzhen. And Henan is the second most populated province in China, and it's also located between Wuhan and Chengdu, Panda Land. So that's a province, just to the west of Hubei province. And it's 21 cases. I don't know why that's spelled out today. It happens every so often. And in Heilongjiang province, which is where Harbin, the ice festival city. Harbin is one of the largest cities in northern China, or it's the northernmost of all the large cities in China. and it has an international ice festival there every year that started in December, and that's probably the reason why they have a large number of cases. And it was shut down early by the government due to, it was about the same time that China, the central government, shut down the Chinese New Year celebrations and all large gatherings. So that was happening about the same time. Then if you scroll on further, you'll see some hot searches for today. So remember, Baidu is a search engine, and this is just like looking at Google and seeing what the hot topics are for today. Only sometimes, they don't make any sense because these are search terms that were used, and they use some logic there to figure out what story these search terms are talking about. So there's 5 that I wanted to take a look at today. I usually only look at 3, but there's some interesting ones here. So I'll take a look at those in the next couple pages. The first one that was kind of crazy to try to figure out. 23 relatives and friends had dinner together, and 20 confirmed cases, 7 critical cases. So there's, the government's taking a look at this and trying to figure out, how did this happen? How did we, first of all, allow all these people to get together? How do we prevent it? So 23 people get together and 20 of them are confirmed cases. 7 of them are in critical condition right now. So that's a little bit of craziness. Then the Ministry of Education is just speaking out about colleges and saying, they're closed for now, and they're taking a look at things. And then there's an article about Iran's health minister. Next week will be the peak of the outbreak. That's what Iran thinks. I don't know how many people believe that, because we'll take a look at Iran in detail later. And then the last 2 stories, Tianjin responds to the violent law enforcement against scavenging elderly people. So this is, there were some elderly people out on the street scavenging through, papers or plastics and sorting things, and the police, since they were out and they shouldn't be, they came down on these people pretty hard and physically, assaulted them basically. And there was a public outcry about this. So Tianjin is a city that's southeast of Beijing and pretty close to Beijing. Pretty famous city for the Tianjin University and for that huge chemical explosion a couple of years ago that put a crater in the in the Bay Area, where where there a lot of storage facilities are located, and that made the national news, the international news. And on the bottom right, there's some people from another province. This is in Xi'an, which is a city, where there's still some people, I think, living in caves. It's famous for their cave people. Only most people don't live in caves anymore, and the caves aren't like, pre-human beings. They're just caves where people live for a long time. So it's kind of a historical area of Xi'an. But anyways, there was a big dance there, and they said that half the people weren't wearing masks, and somebody filmed it, and that drew attention of a lot of people on Baidu, because everybody's concerned that there's people outside in big groups without masks on. Then the next thing we do is take a look at the coronavirus global tracker, and there's a few of these now, but I use the one from Johns Hopkins University. CSSE is a research institute at the university. I still haven't looked. I looked up the name of it because I worked at a research institute at Johns Hopkins for a little bit. This is not one I worked at, and I'm pretty sure this would be affiliated with Johns Hopkins University and not Johns Hopkins Hospital, because it's a Center for System Science and Engineering. So they've been tracking this for a long time, and it's a really good tracker. And I take a look at it every day. This shows you globally what's going on. So the first thing I do is compare Baidu's number for China with what Johns Hopkins shows for China. So you can see 79,389. So we're up 139. So you would have to add that to the 85,000. You'd still get 85,000. So sometimes there's a difference of several hundred. That's why I look at that every day. So Johns Hopkins is a little bit low, but it's pretty much right on. Then the next thing I do is I compare it with yesterday just to see what's happening with some of these crazy countries. So first there's a trio of countries here that are really alarming people because of the number of viruses that are being confirmed, number of cases going up and the number of deaths. So the WHO released a statement that relates to the global level, and they said the risk of COVID-19 is now very high at a global level. And that's not just because of these three hotspots. It's because it's spreading everywhere. There's new countries popping up every day. Like today, Estonia. Now, how does Estonia come up with a coronavirus case? I mean, it's one of the Baltic countries. Just to the west of Russia. On the the Baltic Sea. It's crazy that a case would pop up there. So I want to talk a little bit in detail about these three hotspots. So first of all, South Korea, which these are screenshots from yesterday that I left up there intentionally because they were pretty important. So this is, South Korea's issue came from, this doomsday church, which they were sending people into Wuhan until December. So that's how South Korea got affiliated with China and the hotspot in China, which is Wuhan. So as late as December of last year, they were sending people to Wuhan. Then, one person got infected somehow when they came back. Probably other people would be positive, but maybe they weren't showing symptoms, and they infected one woman who then infected 40 others, and that's how it all started. And then another article from yesterday that I left up here, just to take a look at the massive numbers of this religious sect, that there are 1,000 churches in South Korea and 240,000 members. So it's a pretty big outfit. So staying with South Korea, there's an article in the Wall Street Journal about South Korea spends billions to try to, lessen the economic impact of the coronavirus. And those people in that sect, that religious sect, are saying that we're treated like criminals. That article made The Guardian, which, yeah, they probably are. And then COVID-19, Malaysia bars travels from South Korea. You're going to see that popping up all over the place. All different countries restricting travel, incoming flights from South Korea because they don't want to be infected. And then BTS is a boy band from South Korea, K-pop group, and this is probably the most devastating thing to South Korean teenage girls, of the whole thing, the whole worldwide problem, BTS not going on tour this year is probably the most alarming thing to them. So then we move to Italy, another hot spot. So crazy things are going off on my screen here. I left a map up here for Italy on the upper right, and that's from yesterday also. That just shows you where the hotspots are in Italy. And it started, in the northern provinces of Italy. And one thing about Italy is they still have not figured out how the first person got infected, who the first person was. It's pretty important to, find, the first person who was infected. So you can, map their travel and see who they came in contact with. But we're just learning, now that new cases are popping up all over the place. So I forgot to mention before, South Korea went from 1,595 to 2,022 cases on the 28th. Italy now has gone from 453 to 655, so they're going up like crazy. Italy has a red zone that's isolated, and you can see that on a map. That's actually a whole province there that's in the red, but within that red area is something they call a red zone. That's just the roads are blocked off. Nobody enters, nobody leaves. But it's still pretty alarming that they haven't figured out how the first case got to Italy. And then you can see on the bottom right, coronavirus Italian cyclist confirmed to have it now. It's spreading all over Italy. The yellow areas are all have infected patients on that map on the upper right. And I don't know how important this is. After refusing Italy travel curbs, Germany becomes a top 10 coronavirus nation. That sounds like something that CNN would publish. It's just bullshit. I shouldn't have put it on here. But the writer of this art, sometimes journalists just kill me. You get a bachelor's degree in journalism, which is, not rocket science. And then these people, write articles. So did somebody do some research here and see if Germany would have become a top 10 without this Italian travel curbs? Did travel from Italy affect it in any way? Probably not. So Iran is the third hotbed, and it went up from 189 to 245, but a lot of people think that that's not accurate. You can see the BBC here is reporting that Iran's death total is 210. So that would put the number of infected people in the thousands. But Iran became infected. Well, nobody's sure how it became infected, but once people, it's because of a pilgrimage made to a city in Iran, and these people are coming from all over. Saudi Arabia just announced today that they're going to stop the pilgrimage, that people aren't allowed to travel to Iran now. But Iran came out with an official view yesterday. Their leaders, and I don't know, I forget whether it was political leaders or religious leaders, said that they encourage people to go to that city. They're not stopping people from going there, or not discouraging people from going there. So here you can see this religious site here being disinfected with alcohol. So that's what's happening in Iran now. There's still people going, but I think we're going into the last couple days of that pilgrimage to this city. Then on the bottom right, President Trump today offered help, or the Secretary of State officially, through Switzerland, because we don't have any diplomatic ties with Iran, but through the Switzerland embassy offered help in, helping the Iranian people. And BBC on the lower left, Iran's deaths at least 210 according to hospital sources. So that's really alarming. That would really mean, since the mortality rate is 2%, that would mean that, the issue in Iran is a lot bigger than 245 confirmed cases. So this is the Diamond Princess, and I'm going to spend a little bit of time talking about this because I haven't been lately. So we have this 705 others right here. Others means cruise ships, and really there's only 2 cruise ships. One of them had only 1 confirmed case on it, and that cruise ship was trying to dock in Southeast Asia at various countries, and Thailand said get out of here. Nobody would let them dock, and finally Cambodia allowed them to dock, and I think there's still only 1 patient that was a confirmed case on there, and I'm not sure how the repatriation of that thing is going, but probably people are just using their original travel plans to go back to whatever countries. They're not being evacuated by their country because there aren't a big number of cases on that ship. But what came out today first was a British citizen, first British citizen to die, was somebody who was quarantined on a Diamond Princess ship while it was in Yokohama Bay. So Great Britain has lost its first person for the first death to coronavirus. And then I have a little map here to show you where Yokohama is. Yokohama is a port that's also in the Tokyo Bay. It's just south of Tokyo. that entire area is just such a highly populated area from Tokyo to Kawasaki to Yokohama, just really high density of population there. And we'll show you later there's another hot spot in Japan. That's why I'm showing you Tokyo here in Yokohama. So this came out today that, I'm not going to go over all of this, but this is a really good article by Al Jazeera. And another reason it's good is because, you can go to this news site here and you don't have advertisements popping up all over the screen and people telling you, join our screen or you can't read anymore, or join our site, pay money for news, in other words. So this is more about the crew because all of the passengers have been taken off of the ship. But this is, first it talks about the Filipino members of the crew. 645 Filipino crew members have been repatriated back to Manila, the Philippines. They're at the Clark Air Force Base, which was a U.S. Air Force base. So they're at a quarantine site on that base right now. Even the officials that went down there with them are going to go through the quarantine process too. So, and then the World Health Organization, reported 634 infections and 2 deaths among those on board. Well, that's old news now because, that number is way up. But an estimated 2,670 passengers and 1,100 crew members were forced into quarantine on February 3rd. And the reason that was because somebody disembarked the ship, a woman, and later tested positive. So they had to quarantine the ship. But this article is basically focused around Japan's mishandling of this ship. Somehow Japan let the entire ship get, infected with coronavirus. Not the entire ship, but half of it. So this is crazy stuff. So in addition to Filipina, we also have most of the crew on the ship were Filipina or from India or from Indonesia. I'm sorry, Filipino, not Filipina. Filipina is ladies from the Philippines. But the Filipino was the biggest part of the crew, Philippines people, begging for help. So here's people from India who got on and said, hey, please help us. And then the Indian government announced a chartered flight was headed to Japan to bring back 138 of its nationals on the ship. 14 others who are infected will stay in Japanese hospitals. Then we have people from Indonesia. Meanwhile, 69 Indonesian crew members are still waiting for a response from their government. Down here, the government issued a statement, or not a statement, but they just said they're not in a hurry to repatriate their citizens back to Indonesia because they don't want anybody infected. Well, take your citizens back and put them into quarantine. You can't say you're not going to take them. They're sitting there on a cruise ship. But, you got to hand it to the crew here because the passengers stayed on this cruise ship for an extra couple weeks, longer than they were supposed to. So the crew had to, work an extended period instead of being done with their cruise ship and going home for a couple weeks and relaxing before their next cruise starts. They're stuck on a cruise ship. They're still feeding the people. They're doing laundry for the passengers. They're reading notes on the doors that are posted saying, I need this and I need this. And the crew is just, helping to the end. And the crew, they're all staying together in the lower decks together. They're not quarantined. They're not separated from each other. So they're, whoever was sick in the crew is going to get everybody sick there. This is just a total mishandling of everything. And it's really sad that, I hope no members of the crew die from this because they just, they went through hell being on the ship and, serving the passengers for an extra period of time. And another thing on the right here says exploded for their desperation. Let's go to the next page. So it said here that, I don't know where the numbers are. Maybe they're on the previous page. But there's something like, there's there's a demand for 400,000 cruise ship personnel at any point in time. And there's 700,000 qualified people. So there's, the Philippines is in really, really bad shape. They have no economy. The people in the Philippines, they go to other countries to work, and that's the way it's been for, a long time. They go to another country to work, to send money back home for their families. So it's, and they live in poverty, and, it's not like they make a lot of money, but what money they do make, they use to feed people that, feed their families. So, they say that each time a seafarer sets sail, they sign a contract for a few months. There's no guarantee that they're going to have another job when they get back off of their last ship. I wouldn't be surprised if the cruise ship said, well, you were on the coronavirus ship, so we don't want to hire you. Hang around for another year and make sure you're okay, and then we'll think about hiring you. So it's just sickening the way this whole thing was treated by Japan, and it's really sad what the crew had to go through. Then we come to Japan, outside of the cruise ship. So Hokkaido just declared a state of emergency. Now, I put another map of Japan here. Hokkaido is a big, it's a province. It's also an island at the top of Japan. It's, famous. It's got ski resorts. And that's how they think that a problem started there, is because, there's Chinese people coming in to go skiing too. So, nobody knows exactly, where patient zero is there or how it started, but there's a lot of infected people in Hokkaido, and now they declared a state of emergency, so they're going to lock down on that province too, and that includes Sapporo, which is the only big town in Hokkaido, the big city, I mean. So that whole province is going to be locked down now. Then what else we have in Japan? Okay, Abe came out on the 28th in Japan and announced that schools will be closed. And this, just without any warning, just schools will be closed. Okay, so your kid's going to be home today. So you got to find something for your kid to do, and you're leaving for work, Schools are closed effective now, and, it really annoyed a lot of Japanese people because, they just had to make arrangements at the last minute or stay home or call off work themselves because, their kids are home. And this is, might be a little bit of an overkill, but, Abe's got some other things to worry about. He's got, the cruise ship thing with people, in Yokohama getting infected from the cruise ship, hospital staff and stuff like that. And then you have Hokkaido, who's, big, just declared an emergency. And they have to host the Olympics in 4 months. So, people are criticizing Abe for doing this, and they're criticizing, that the schools were closed because of the mishandling of the cruise ship, which is partially true. But either way, a lot of people in Japan are not real happy that schools closed at the last minute, and they had to deal with it. Then what do we have? The USA. So this article here, again from Al Jazeera. Iran VP infected, Saudi halts the pilgrimage. The VP infected was a couple days old news. Al Jazeera is just covering that. Saudi halts the pilgrimage to Iran, and that happened yesterday. And then, that doesn't have a whole lot to do with this press conference that Trump appeared at today, saying that, he got his U.S. Health and Human Services Secretary. People, I don't know if you call them people or not, the Democrats are, going on another witch hunt for Trump. And they'll blame him for everything now because there's nobody in charge of everything. Well, Trump kind of just put, Pence in charge of everything. Said he's in charge of the coronavirus thing for the country. I mean, we have people to deal with stuff like this. And the people that we have to deal with this, it's not it's not one health organization. It's, all kinds of national health organizations and local health organizations. And, I don't know what good it would do to put a special committee together to do things when the states and cities and, everybody has their own health organizations. So in another thing that's going on in the U.S., another coronavirus case of unknown origin identified in California. So this is really concerning that you have people popping up testing positive for coronavirus and no travel history, no telling how they got it. Maybe they picked it up off of, seating or, doorknobs or whatever. It's just really something you don't want to hear is people are getting coronavirus without coming into contact with people who have traveled. And then Oregon coronavirus infection becomes a third case of unknown origin in the United States. So there was one, a week ago, the first case, and now we have two all of a sudden popping up, one in California, one in Oregon, who, are tested positive coronavirus for no known reason. And also, today, the CDC has announced that they changed criteria for testing patients for coronavirus after the first case of unknown origin was confirmed. So this is coming from CNN, and this just happened today that they changed the criteria. And it wasn't after the first case was confirmed, because that happened at least 3 days ago. There were two more cases today of, unknown origin cases popping up. So anyways, the CDC decided, since one of the problems with these people is they were refused testing because they didn't meet the test criteria. So, and then doctors happened to insist on, the person from California, the second person, doctors insisted that that person be tested, and they were tested and it proved that they were positive for coronavirus. So there's something wrong with the testing procedures, the criteria. So the criteria was changed today. So the U.S. should be faster to test people. And one thing that they said in this video is that, there's reports that, some countries like South Korea, they're testing 1,000 people a day. And the United States has only tested 1,000 people altogether. And those people that they're testing are the original people coming back to the United States from Wuhan. Remember, that was our first, 10 cases or whatever, popping up in, Seattle first, and in California, Chicago, Boston, Texas, Arizona. So these were all people who traveled to Wuhan, and the people that were on airplanes with them were make up the most of who's been tested so far. People who came in contact with those known cases. So they're really changing things. They're going to start testing a lot more people now. And then I just put this map. This is part of the Johns Hopkins thing. If you click on the list of countries on the left, you can expand that to all the countries. And I didn't catch all the new ones today. Estonia was new today, and who else was? I don't remember. But just look at the number of countries here. You have mainland China, you have South Korea, number 2, then Italy, then the cruise ship, which has to be way down from 705 now, because a lot of crew members have been repatriated, and all the passengers have been repatriated, so there can't be 705 people left on the ship. Then Iran, 388, and since that one article says we have a couple hundred that, have died, then that means that, that number should be, several times that size. Japan, they're fighting the coronavirus and, with the cruise ship and with Hokkaido, so they've got a couple of areas. And then after that, the U.S. is up to 64 cases now, and, we were at 16 before we started repatriating people from the cruise ship. But, Singapore at 93, Singapore is growing a little bit. That's a little concerning because Singapore is such a small place, it's not anywhere near the size of Hong Kong. Singapore is a city-state, like on the bottom of the Malaysian peninsula, where it's just a very small place to have that many people. But, people from Wuhan, when the coronavirus first started popping up, they went everywhere. They went to Japan to go skiing. They went to, hey, let's go someplace warm like Singapore or Hong Kong, or, let's go to South Korea. let's go all over the place, and that's why people from all over the place are infected now. Thailand and Vietnam. But you can just look down this list and see how many countries are involved now. And the numbers aren't very big in every country, but it's scary that you have the first, even Estonia popping up today with the first person. Now, who did they come in contact with? Surely, the family of that person are infected. So all of these numbers, unless they're really old, like Sri Lanka had one person infected a long time ago, and it's been that way for, about a month now. So apparently that's not going to grow. But a lot of these countries with one infection, you have to wonder whether they're going to turn into an Iran or Japan or Italy, because they started out with just a couple. And the last thing I take a look at every day is this graph from Johns Hopkins. It's the lower right graph, and you can click on an icon in the upper right hand corner and it'll expand this graph so you can take a better look at it. And I put these, red lines on here just to see the trends and several days in a row. So we can see about, right around Valentine's Day, we had a few days where we were a lower, shallower slope than the line before, so things were tailing off a little bit. And then the next 4 days, things were really tailing off in China because China's getting things under control. And then now the line is heading up again because of countries outside of China. So that's what's really alarming, as the trend keeps going up. We're, heading toward, we're at 83,000 now, heading for 90, heading for 100. Who knows where this is going to stop? So anyways, that's all. I stop every day at this graph, and that's all we have for today. Appreciate your time.